Hello students, today we'll start with the stages of the general anesthesia. As you have already seen what is general anesthesia and why it is given to the patients. So just a revision, general anesthesia is general anesthesia is a drug which produces a controlled reversible depression of the functional activities and of the CNS and produces the loss of sensation and consciousness. So, what are the stages from which a patient is going through when the inhalation anesthetics is administered to a patient? Some of the following well-defined stages are produced by increasing the blood concentration of the agents. They are stage 1, 2, 3, and 4. Analgesia stage, delirium stage, surgical anesthesia stage, and last is your medullary depression. So these stages are being classified by the Dubel signs, that is known as the depth of the anesthesia. A Dubel scientist in 1920 described the four subsequent sequential stages with either anesthesia, dividing on the stage 3 into 4 planes. They have divided of 4 stages, and of the stage 3 they have divided in a 4 planes. The order of depressions in the central nervous system is cortical centers, basal ganglia, spinal cord, and your medulla. So start with the stages. First is the stage of analgesia. What is analgesia? Analgesia is to relieve the brain so that it cannot rest. So analgesia and amnesia, the patient is conscious and conversational. Start from the beginning of anesthetic inhalation and last up to the loss of consciousness. So the pain is progressively abolished. Reflexes and respiration remains normal. Use is limited to the short procedures. It is used only for the short procedures. Moving toward the second stage, stage of delirium. In this, the patient loss of consciousness to the beginning of the regular respiration. Patient may shout, struggle, and hold his breath. Muscle tone increases, jaws are tightly closed, breathing is jerky, vomiting or involuntary micturations or defecation may occur during the procedure. The heart rate and blood pressure may rise and pupils dilate due to sympathetic stimulation. So, no operative procedures carried out. Can be cut short by rapid induction. Pre-medication is needed. Moving toward the stage 4, stage 3, that is anesthesia phase, and it stands from the onset of regular respiration to the cessation of spontaneous breathing. This has been divided into 4 planes, which may be distinguished as plane 1, roving the eye wall. This plane ends when the eyes become fixed. Plane 2, in plane 2, the loss of corneal and laryngeal reflexes, and in plane 3, pupil starts dilating and light reflex is lost. Plane 4 is intercostal paralysis, shallow abdominal respiration, and it dilated the pupil. Next stage is the medullary paralysis. In this, the cessation of breathing to failure of the circulation and death. Pupil is widely dilated and the muscles are totally flabby. Pulse is thready or imperceptible, and most important in this stage, the blood pressure is very low. This is a diagrammatic representation. First stage where the respiration, we have given all the things like respiration, ocular movement, pupil size, what is the size of the pupil during every stage, what is the eye reflex, muscle tone, what if it is normal or a dense struggle or a flaccid condition, respiratory responses to the skin incision, So in a stage 3, there is a no response to the skin incision. So these are the four stages of the anesthesia by given and explained by the Gödel science. So what are the characteristic features of an ideal general anesthetics? So an ideal general anesthetic should possesses the following characteristic features. It should be inert first of all, and it should be potent and non-inflammable. It should be non-irritating to the mucous membrane. It should not produce rapid and smooth anesthesia. It should produce analgesia and muscle relaxation in addition to the anesthesia. It should not produce a severe hypotension. It should not produce nausea and vomiting, and it should be compatible with the adjuvant drugs used in the anesthesia, like your pre-anesthetics, and it should be economical so that the people can afford for the procedure. It should be stable to heat, light, and alkalis so that it cannot be deteriorated in heat, light, and alkalis with the exposure. So these are the points should be kept in mind while choosing ideal general anesthetics. Thank you.